comedonal acne. What does that mean?
Okay, this is just strictly when the oil and the dead skin cells together have caused this little backup or plug in the upper part of the follicle. And of course, that doesn't keep the oil from continuing to be produced, so it'll produce behind that, and you get these little raised plug-like lesions. These are called closed comedones, or some people call them whiteheads. And then you can get what we call open comedones, which are blackheads.
So how do you treat this person? Is it because this person's eating too much chocolate?
No, it has nothing to do with chocolate.
Greasy foods
really have not been shown to have much effect.
So that's really not that. It's really a problem that's going on. Is that a disease problem, or it's just a natural thing that happens?
Well, in a way of speaking, it can be just a natural thing, and it's automatic. I mean, if you're going to make the hormones, this is going to happen. And at this stage, it's not going to cause any permanent damage to the skin, so it's not absolutely necessary to treat.
How are we going to treat it, though? Because I'm sure this is embarrassing to this patient. I'm sure that, they feel like everybody's looking at them. There's nothing to me.
Absolutely. It causes a lot of more mental devastation than to the skin for kids this age. So over the counter, there are products like salicylic acid, which are common, that can be used for mild comedonal acne, but there are excellent prescription medications we can use when it becomes more severe. Retin-A is the classic treatment for comedonal acne, but there are others like Differin, which is a little less irritating, or Tazorac, which is a little stronger, that work beautifully on this type of acne.
The way they work is what? They just clean off the top of that pore?
They basically do. They're excellent at causing the skin cells to exfoliate, which is why many people complain at first that they made me peel. Well, that's pretty much what they're supposed to do, but that really is only the beginning. That's why a lot of people say it makes you worse before you get better.
Tell me how we get to a second type of acne.
Right. Well, when that pore clogs up, the oil continues to be produced, okay, and it has nowhere to go but down into the follicle. Well, there's a natural population of bacteria that live in your follicles, usually a small number because their number is controlled by the limited food. Well, now we have a smorgasbord, so they start multiplying like crazy, and we end up with papular pustular acne like this.
Papular pustular. Now that means raised and pussy.
That's right. Inflamed red pustular acne.
Does this damage the patient's face later on?
Generally, if it's not picked, no. Most of these will resolve on their own as long as they're not touched.
What do you do with this person?
This person could try maybe a topical antibiotic, or an antibiotic in combination with benzoyl peroxide. That's your good old-fashioned acne medication that's been out for years. Proactive that you see advertised, Clearasil, Oxy, any of those products are benzoyl peroxide, and that would be ideal for someone like this. If it gets a little worse, an oral antibiotic could be considered.
What kind of results do you get if you use that type of treatment on this type of acne?
If it's done really consistently, which is very important, it could really clear this patient up very nicely.
What's the difference in this and the last picture?
Okay, this is nodulocystic acne.
Nodulocystic. Now, walk me through, what does that mean?
Okay, that means that the hair follicle has actually become so infected that the wall has ruptured. Okay, and when that happens, all of that oil and bacteria and dead skin debris end up in the dermis, or the middle layer of the skin. That's where the collagen and elastic tissue fibers live. And that's why this can possibly scar. Now,
so this can scar, and so if untreated, this person has a good chance of having scars. What can you do for this patient? And how important is for this person who has this cystic nodular acne to come in early to see a dermatologist? How important is it?
Sure, it's very important. It's not a situation where it's life-threatening, of course, but the acne scars, as I mentioned, are really pretty permanent, so prevention of the scarring phase is really important, being able to distinguish between just garden variety, almost not a disease acne, and a part of the acne spectrum which really can cause permanent damage.
What do you do?
Yeah, initially you could easily try a topical Retin-A type drug to open the pores, and an oral antibiotic, and that combination can, for mild nodulocystic acne, be very effective.
What does Accutane do? And one of my children was on Accutane. It made unbelievable difference in their life. But when they use it, their lips dried up and cracked. They had to take it for a month or two. Tell me about that.
Right, you actually take it for 20 weeks, which is about 5 months. And Accutane is actually a chemically engineered form of vitamin A. And it's actually safer for persons to use than a comparable dose of vitamin A would be. But vitamin A has multiple different effects in the skin. It can cause wonderful sloughing at the open of the pore, like Retin-A, also a vitamin A-based drug. But the main thing it does is cause an irreversible shrinking of the oil gland.
So it really is
Gets rid
magic
of the fuel.
to some
Absolutely,
people.
absolutely.
Now, in 45 seconds, which is not long enough, but we've got to talk about, is Accutane dangerous? Because I've heard the scare on depression, I've heard the scare on birth defects. So what's the
Birth defects is absolutely true. So all of our girls do take the birth control pill. It doesn't affect future fertility. It only affects developing fetuses. So as long as you're not pregnant, not a problem. And as far as the depression link, there have been 3 major studies that have shown no association between Accutane and depression and suicide in teenagers, no matter what you read in the papers.
So the important thing is to know is be guided by the dermatologist. Ask them questions. Get the answers from your dermatologist. The difference it made in one of my children was unbelievable, and it made me know how wonderful this medicine can be.
It absolutely can be.